Now I'll move to the electronic prescribing program. In order to receive the incentive payment for 2011, an eligible professional, again, physicians and other professionals with prescribing authority who are paid under the physician fee schedule, they must be using a qualified electronic prescribing system, and they must report on at least 25 electronic prescribing events by December 31st for the incentive. If you submit some electronic prescribing events by claims and then you switch to a different reporting method, such as a registry or an electronic health record, the claims submitted events will not be added in to your other method. You'll still need to submit at least 25 electronic prescribing events by one method in order to earn the incentive. You cannot receive the electronic prescribing incentive if you are also receiving the Medicare EHR incentive. I want to tell you about the electronic prescribing adjustment. We strongly recommend that you begin electronic prescribing and begin reporting this to avoid the 2012 payment adjustment. You'll need to report electronic prescribing by Medicare claims, and this is the only method of reporting to avoid the adjustment. You'll need to report on at least 10 electronic prescribing events for dates of service between January 1st and June 30th, 2011. There are specific hardship codes for rural areas without high-speed internet access. That's code G8642 to be reported at least once. Again, for rural areas without high-speed internet access, that's code G8642. There is a hardship code for areas without sufficient available pharmacies for electronic prescribing, and that is code G8643 to be reported at least once. Again, that's for areas that don't have sufficient pharmacies available, G8643. And there's also a code for eligible professionals that do not have prescribing privileges, which is code G8644. There are other exemptions for having fewer than 10% of allowed charges attributed to claims eligible for electronic prescribing, meaning that are codes that are in the electronic prescribing denominator, and also for having fewer than 100 eligible encounters, which are also with codes in the electronic prescribing denominator.
Is an electronic prescribing event a single prescription?
Yes.
So that'd be one prescription?
Yes.
Is that the patient that gets two prescriptions? Is that two events?
Let me repeat your questions. The first question was, is a single prescription an electronic prescribing event? And that answer was yes. And the second question was, is one patient with two prescriptions, is that two separate events? I believe that, I have to look that up, I believe that's not. I will get you an answer later. You can be subject to the payment adjustment even if you receive the e-prescribing incentive. And that's because to avoiding the adjustment means you must report at least 10 instances of e-prescribing by June 30th. But for the incentive, you'll have through December 31st to report 25 instances. So what is the adjustment? If you're not a successful electronic prescriber by June 30th and not excused because of hardship or having too few cases, the total allowed Medicare Part B charges will be reduced by 1% beginning in January 2012. Again, if you report a hardship code by June 30th, this adjustment will be waived for 2012. CMS will be accepting comments during the physician fee schedule rule comment period during summer 2011.
My understanding is you have to have a qualified system to avoid the payment adjustment. That there are e-prescribed softwares and EHRs that have been certified and qualified for the incentive. However, when you go on the CMS website, it has all of the EHRs starred with a statement at the bottom that says these are not approved in order to avoid the payment adjustment. I can't find anywhere on CMS website that says what e-prescribed softwares are qualified to use so that you don't suffer the adjustment. It tells you a paragraph of as long as your system does this, then you're okay. When will they be putting something out that says what e-prescribed softwares are qualified to avoid the adjustment?
The question was, I am having trouble finding on the CMS website what e-prescribing software is qualified to avoid the adjustment. As you pointed out, there is a description on the website of the features that qualified e-prescribing software has. I do not believe that they're going to put out a separate list of qualified e-prescribing software. They're asking you to check on the software that you are looking at to see if it meets these criteria.
So they aren't going to certify any. We just have to interpret what's on there.
We just have to trust you that our judgment's going to be okay and you're not going to take the money away anyway. That's what you just said.
My understanding is that that list of the features that is required for the e-prescribing software is the only description that is going to be provided.
But you're unwilling to say which ones?
Given the short time frame now that it's April, I really don't think that something's going to be posted between now and June 30th.
Okay. I'd like you just to, so that people in the back of the room can hear some of these questions that are coming. I have a microphone. I'd love to, if you raise your hand, I'll walk to you. But we want to make sure that we finish the program first. We'll have some Q&A in between the panel discussion and this. So please, in the sake of time, let's get through the program, and then we'll come back and hit your questions, okay? We good for that?
Well, yeah, please make a note of your questions, and we will address them at the end of the program. Here are the electronic prescribing deadlines. All claims must be received by the end of February 2012 for care provided through December 31st, 2011, to be considered for the incentive. Registries, electronic health records, and group practices doing the group practice reporting have to submit their data by the end of March 2012, again, covering dates of service for calendar year 2011. And again, to avoid the 2012 payment adjustment, report the required number of electronic prescribing events, which is at least 10, or a hardship code on qualifying Medicare claims by June 30th, 2011. And again, these are some resources. This is the e-prescribing website and the contact information for the QualityNet Help Desk. Again, please write down your questions, and I will turn the program over to Darcy.